1949, a partnership here in the town of Seward was put together to build a new hospital. Prior to that, the hospital was in a variety of houses across the town, and so in 1949, an organization was put together to create Memorial Healthcare System. And then over time, over the next 70-some years, a variety of changes have taken place, a variety of new services come on board, ownership of hospitals, ownership of the clinic settings, and transition to other types of services over 72 years. The number of employees that Memorial Healthcare Systems currently has is right at about 280 individuals work in the organization, both full-time and part-time. Memorial Healthcare Systems is a private, not-for-profit organization. So with that, we have a mission statement along with a statement of values for our employees, where our whole focus is on delivering the appropriate amount of services, the right services for our community, and being responsible to those services so that we can continue and sustain having hospital and healthcare services here in Seward County. My name is Roger Reamer. I'm the CEO here at Memorial Healthcare Systems. I've got my bachelor's degree in economics and a master's degree in business administration.
I'm Dr. Joel Gabriel. I've been working here for about a decade now, and I was born and raised in Seward, Nebraska, and went to the University of Nebraska-Lincoln for undergraduate school, and went to the University of Nebraska Medical Center in Omaha for medical school, and I stayed there for residency in family medicine, and then following that came right back to Seward.
My name's Brenda Smith. I've been working here at Seward for 24 years. I did my undergraduate work at Chadron State College. I got a bachelor's degree in biology there, and then did a 12-month medical technology program at UNMC in Omaha. Went to work at St. E's in Lincoln for just a few months, and then I landed in Seward. Have been here ever since. So, education-wise, I started college thinking I wanted to go into engineering, and worked from that into physical therapy. Got into some of the human biology classes and thought medicine. Then thought maybe not full-fledged MD kind of worked for me, and medical technology was kind of my backup plan. Ended up falling for it, and it's many years later, here I am.
I'm Audrey Fisher. I've been a nurse for 7 years now. I'm from Seward, born and raised. I went to college in Lincoln and then came back here and worked here at the Seward Hospital. I started when I was in high school and just really felt comfortable here. I decided to go to the nursing field after in high school. We went to Southeast Community College for just a career day. And at first I was looking at respiratory therapy and went to the nursing booth and really just found an interest. It just interesting all around, and decided to pursue that and went to school and decided to come here. Well, I stayed here. I started working here and just felt comfortable and kind of eased into the nursing position.
My name is Michaela Pickerel. My position is a radiology technologist. I went to SCC in Lincoln and I did my prereqs. I started in August of 2018, did my prereqs in about 6 months. And then after my prereqs, I applied for the radiology program. And I started that in August of 2019. And then I graduated in December of 2020. So about a 16-month program just for the radiology. So about a little over 2 years for the whole entire prereqs to graduation from radiology program.
I feel like communication is probably one of the most important skills that I have, and that doctors in general have. We have to be able to communicate with patients. We can know a lot of things, but if we can't get that point across to the patient and hopefully spawn some sort of positive change, then we haven't really done our job. So communication, obviously we need to problem solve. Oftentimes people think that medicine is black and white, but there's a lot of gray in between, and sometimes you have to go on what you know to try to kind of figure out what is not known, and be able to come up with a plan that maybe isn't always something that would have been clear right away. And lastly, you have to be compassionate. My duty to them is that I take the best care of them that I can.
Day to day is getting here about 5 a.m. and doing vitals assessment on patients, giving medications, bathing, the typical ADLs of a patient and just contacting with or talking with the physicians, coordinating care with patients. My schedule is I work 3 12-hour shifts a week. They're 5 a.m. to 5 p.m. roughly. And it just varies throughout the week. It's every third weekend, which is a Friday, Saturday, Sunday. And so you still have plenty of days off during the week, which is nice.
And typically, I will start my day off with a little bit of paperwork early in the morning, trying to get things done from the previous day, refill requests, faxes, things like that. Then typically we'll head over to the hospital and do rounds for my inpatients, whether they're there for some sort of illness or injury or post-surgical. And then following that, I'll come over to the clinic and do a clinic day. And then after clinic, try to clean up again some of the paperwork and refill requests and things. Throughout that, work with a lot of different people. We will work with nurses who, even though I come up with the plan, they're the ones that implement it and spend the most time with patients and give medications over the hospital or follow orders or calling and making referrals, things like that. When I'm doing the refill requests, we're working closely with our pharmacists and making sure that we get medicines filled appropriately and timely so that there's not any interruption in people's treatment plans and things. Oftentimes we'll collaborate with other physicians. Sometimes we'll have something that we just kind of want to run by them and see if it sounds like a reasonable plan and see if that's what they're thinking. I work pretty closely with many of our PAs here too, our physician assistants. They oftentimes will see more of the acute urgent things like coming for a cold or other things like that maybe are not scheduled visits. You wake up and you have some sort of illness and you want to see somebody right away to figure out what's going on. Oftentimes they have more room on their schedule and we actually have a walk-in clinic that can then be available for people for that purpose.
We clock in at 7 and then we set up paperwork for that day. And then the 2 days after that, so we set up for 3 days of paperwork. We have phone calls coming in all day from outside providers and our providers here at Memorial Healthcare Systems. And then we make sure our rooms are stocked for the whole entire week. We check on linens, the cleaning supplies that we need, any contrast that we would need for CTs, and if we don't have enough, we just order from the pharmacy.
Day to day, we're lucky here, I think, that we get to do a little bit of everything. We're generalists in the laboratory here, which means we do everything, like I said, from frontline blood draws to all of the lab testing we're all doing in here. So each day we get kind of a different assignment. So one day you'll focus on one department or 2 departments, and then the next day you'll be in a different area.
Day-to-day activities and my role as a CEO here at Memorial Healthcare Systems from a day-to-day standpoint, just a lot of time spending planning, strategizing, reviewing, working with individuals and leadership across the organization. A lot of meetings, a lot of time spent just evaluating where things are and trying to forecast where we need to be in the future.
And the incentives are they offer on-the-job training. So I did on-the-job training for CT and DEXA. And the benefits, the hospital offers a full benefit package, including health, dental, and vision insurance. They also have a health savings account, and they also have retirement options as well.
Yeah, so first off, it's rewarding. While much of the work is hard work, when you get to see that you've had a positive impact in somebody's life, or you're walking down the street and somebody says, hey, I saw you when you treated me in the ER, and thank you so much for that. That's very rewarding work, and I don't think I could do anything that didn't give me that kind of reward over a long period of time. Generally speaking, it's lucrative as well. I want to take care of my family. I want to earn money, and I want to retire someday, and so that is very helpful. But it also has a very good general benefits package and things like that too.
One of the biggest incentives, in my opinion, is that our community are our patients, and so we're taking care of the people we live with. And for good or bad, we get to know them and we get to know their stories. And if you like the science side of it, in the lab, we see, progressions, hopefully for successful outcomes, but also, the other side of it too. But we do kind of get to see the story beginning to end. So
I was able to do the scholarship here through the hospital. It just required for you to finish the program, obviously, pass the NCLEX, and then they do tuition reimbursement for, I think, like higher level of education, like bachelor's maybe. And then obviously just good benefits of working here. You get plenty of experience working here in a variety of different areas of nursing.
If somebody's looking at getting into the medical field or getting into the healthcare field and exploring that, they need to understand that, you know, there's a variety of different opportunities, whether it's from the clinical side or the business side. Here at Memorial Healthcare Systems, we've got almost 50 different job titles. There's just so many different opportunities. So my main advice to people is usually don't get stuck on one idea, because you may change your mind as you evaluate healthcare as a career path.
First off, work really hard in your studies. It's important to be able to get into medical school that you have to have really good grades. So you have to start there. That's not everything, but you have to start there. Secondly, being a good person to your community as well, where you're getting involved, you're doing things for people, maybe doing some volunteer work, possibly contacting different doctors or specialists and saying, hey, I'd like to come and just kind of see what you do, because sometimes what you think being a doctor is not actually what being a doctor is until you actually gone and done some experience with it. You don't know if that could be the right thing for you as well. So.
Students can shadow us nurses here at the hospital, kind of get a feel of what the nursing field entails, and then definitely reaching out to HR and seeing scholarship opportunities, even getting a job here to start with as a CNA. That's always helpful. And then, you know, while you're getting your nursing degree, you can do your clinicals here, kind of get a feel for, and come back and apply to be a nurse.
If you have a list of things that you think that you might like, write those down and just job shadow every single one of them, that you know exactly what you're getting into before you start doing it.
I don't believe you should land heavy on any one thing. That's kind of the exception, not the norm, but be willing to explore and keep all your doors open.
Do something that you feel personal reward for, not just monetary reward, but that you feel good about doing and that you can imagine doing for the long term.